Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel Miller here with Dr. Tim Augustiniak. Guys, we're going to continue on our little series here of unique clinical cases, and kind of what we're getting into with these is really sharing and discussing the different cases that we've seen that have had different root causes that maybe you wouldn't expect, and then kind of going through some of our kind of treatment and what we found through our exam and through our muscle testing and lab tests and all the fun things as to what was actually going on, and then what we did to fix these things. So we've shared a number of different cases from our first kind of part 1 and part 2. We talked about a number of different things from like Dr. Tim shared a case where a patient had a lot of left side tingling in their body, and a lot of it went back to gallbladder issues, which is super interesting. Talked about a patient that had concussions in the past and then had migraines whenever they would run. And so a lot of different interesting things, as well as like mold issues and food sensitivities and all the things. And I've shared a little bit as well. Last time I talked a little bit about a patient that had IBS, had 3 bouts of diarrhea every morning before going into work, and that was just the norm for him. And literally had 0 diarrhea after that first visit, which was super, super fun. Talked about patient that had thyroid nodules and hyperthyroidism, and how we actually got those nodules to go away, and it was confirmed on ultrasound and all that fun stuff. So we were going to get into a couple more cases each today, and hopefully this is interesting. Hopefully this is a little entertaining, and hopefully it's informational and helpful for you.
Yeah, today's going to be a real good one. You know, I feel like it's the night before every podcast. There's always the text of like, tomorrow, we're recording tomorrow.
It is, yeah.
And topic, but it's like tomorrow, question mark, topic, question mark. Yep. And with this one, I mean, we already said, hey, we're going to talk about all these cases. And so we were like, all right, well, we're running kind of thin on them, but we still have a couple more than we needed to get to. So we figured, all right, well, I guess part 3 it is. So it's going to be a good one. One of my most profound cases that I have had, I have not mentioned yet, and I did not put it in our note. I just brought it up this morning. So you have heard about it, Dr. Joel, but our listeners have not. And it kind of surprised me, because I was talking to some people about it, and they were like, "Ooh, did you talk about that girl?" And I was like, "No, I haven't. That's crazy. How did I not think about that?" So that's gonna be a good one. But anyway, she had I've talked about her in previous episodes, a benign bone tumor that was just causing chronic pain, that we were able to totally get the pain to go away and help her run and all that stuff again. So that we'll get into that. So but anyway, the last 2 that I have to get to are two diaphragm issues tied to plantar fasciitis and trouble with running and pain during running. So actually not pain during running, pain after running. So, but yeah, let's get into it. So do you want to start us off, or do you want me to start us off, Dr. Joel?
I'll have you go ahead. I'm going to get into, I'm going to talk about some of the classic, like kind of some athlete cases. I'll probably just hit on one main one, where athlete sprained his ankle. Is like grade 2 sprain, came in about 36 hours after the sprain. And he was walking coming in, but literally running by the end of the visit. And so that one's a lot of fun. That's a really cool story. And then I'll talk about a woman that had really, really bad periods. And I think she would go maybe 3 or 4 months, maybe 6 months without a period. And it had been like that for a while. So we'll talk about that too.
Gotcha.
I'll have you start us off.
Okay. All right. I was like, are you gonna go with this, or what's going on? So anyway, the patient with diaphragm issues tied to plantar fasciitis. So she had came to see me because she just, anytime that she would run, she would feel fine running, and then for like weeks afterwards, her foot would just kill her. And we went through the whole gambit. We basically started off, when it comes to plantar fasciitis, the 2 muscles that are most profoundly connected to the plantar fascia and causing pain there are the soleus muscle and the posterior tibialis muscle. And both of those are, one, connected to the adrenals, and two, are just used and abused like you would not believe, just from walking around, running, standing, you name it, all those things. So they need to work right, and it's very easy for them to become painful if they're not. And so the problem is it can be very multifactorial what's causing them. I've talked about it in the past, the correlation between those and the adrenals. And most people, if you fix the adrenals, you fix those, and it's good to go. However, we can talk more about this. I'd love to hear your philosophy on this, but there's always the 80% of people that fall within the category of, all right, all you have to do is work through step one, and then there's another 5% of people that you have to go through step two, or I guess maybe another 10% that you have to go through step two, and then another 5% of people you go to step three, and then an even smaller percentage that you have to go through more and more and more and more steps with things. And what I mean by that is, with plantar fasciitis, more often than not, you'll find that there is some sort of adrenal dysfunction secondary to liver detoxification issues, inflammation of the gut, immune system, something like that going on. And if you fix those things, the plantar fasciitis will go away once you correct those underlying organ issues that undoubtedly heals the adrenals. And then from there, you just do some manual therapies and correct those muscle imbalances, work on some trigger points, maybe some scraping, things like that to get the muscles working properly, the soleus and posterior tib specifically, and things do really, really well. But some people, it goes even beyond that, where there'll be pelvic instability due to underlying gut issues that causes, one side of the pelvis to just all the muscles not turn on. And when that's the case, you'll get where everything just kind of collapses. You get knee valgus, where the knee caves in. You get where the arch collapses. And it's not necessarily just a foot thing at that point. It's just like a whole biomechanical compensation cascade thing that you need to correct the underlying gut issue and totally squash that out and make sure that that's stabilized. And then the foot can be, healed at that point. Sometimes you need to address the adrenals directly, where it just takes a whole lot more time, where you need to add in things like adrenal desiccated to help bring the adrenals back up, get that normal circadian rhythm going again. A lot of times you need to do, a couple weeks to months of adaptogenic herbs to heal the adrenals, things like that. Adrenal glandular supplements like drenotrophin from Standard Process. There's plenty of things on that list that you can work through with the adrenals to get those to heal. But then from there, and we've talked about this a million times, there very often are these doors that get left open for underlying, or I guess secondary myofascial or biomechanical compensations to creep in. And those doors are left open by underlying organ dysfunction. So when I say, the posterior tibialis and the soleus are tied to the adrenals, there are neurologic connections between organs and muscles that are basically just embryologically derived. So as we're developing, we all migrate outward from our spinal cords, all of our cells do. And so we have those connections. It's just like when you get, stabbing pains over your gallbladder when you have a gallbladder attack. It's just like when you're having a heart attack, you get left arm pain. It's all the same neurology. And so when I'm referring to that, that's what I'm getting at, is those connections. And so when organs are irritated, muscles also become dysfunctional. So if you have an organ issue that is causing your muscles to be dysfunctional 24/7, and it is never, ever, ever stable, your body is going to fight to do what it can to try to hold on. And so with that, the way that I like to make sense of this is muscles are turned off neurologically. Therefore, they are not completely 100% strong. They're like 80% of what they need to be. And what that means is they don't necessarily accommodate resistance like they should. They basically just start to slip and start to go just functionally weak. They get kind of shaky under resistance and just can't accommodate when we actually just apply force and push on them. When that's the case, all of the fascia and other contractile portions of that muscle are going to fight to hold on really, really tight. And also all the other muscles that are surrounding that have similar functions are going to fight extra hard to try to make up for that weak muscle. So when that's the case, the weakness in that muscle is not just weakness in that muscle. It is weakness in that muscle that causes a need for scraping of that muscle once you treat the organ reflex and treat it nutritionally. It's what will cause trigger points to occur in other muscles that are overworking and holding on too tight, to where basically it's called the sarcomere, the contractile portion of the muscle, gets way too bound up, and you need to manually get in there with your thumbs and your fingers and just dig at it to get it to relax and get the brain to quit recognizing it. as an injury. So then that way things can relax. All of those things will creep in very, very often. And I would argue more often than not due to compensations from these underlying organ issues.
Yep.
If you go through and correct all these things, as well as the myofascial things, you should be able to get somebody where they need to be with their pain complaint.
Yep.
And so that's just a whole rabbit hole on how all this stuff works. But with this patient in particular, we started with gut stuff. Then it evolved to adrenal stuff. Then it evolved to just working on the myofascial stuff. And then it evolved to finally diaphragm stuff, because each step of the way it was, all right, well, clearly things are still bugging you. Let's move on to the next step. Well, clearly things are still bugging you. So let's move on to the next step. And it's just this cadence of things that just, usually you get to a point where like, okay, this is the cause. And each step you think it's the cause. And then as soon as you fix it and she stands up and walks around and it feels better for a little bit, she's like, yeah, it was great for, a couple of days. And then bam, it crept back. And it's like, well, why? Well, this was kind of crazy in my opinion. So most people don't necessarily realize exactly how the diaphragm works. So the diaphragm is not just for breathing. It is for stability of your core. It's for stability of basically your whole body. So it has fascial connections that go up basically the front of your spine, up into your tongue. And so it's really integrated with upper body movement. It's integrated with thoracic extension, all of those things, as well as stability with your arms overhead, all that stuff. It is also super, super involved with lower half of your body stability, in that it's actually connected to your psoas muscle that starts at your 12th thoracic vertebrae and goes all the way down, connects to all your lumbar vertebrae, and then it attaches to your femur to help with hip flexion, external rotation, all those things. And so you basically have this chain of muscle that starts in your legs, goes up to your diaphragm, and continues up into your head via your tongue. And if that's not working, what's going to happen? That is a core. It is a core of your stability, that if it's just not working, everything else around it is going to hold on really, really tight. And so when this becomes dysfunctional, you can get all sorts of other compensations that creep in because things are fighting to hold on. Well, a lot of what this patient had going on with lack of pelvic stability and what kept this plantar fasciitis thing creeping back was her diaphragm just was not working. And so let's back up. More often than not, when somebody has diaphragm dysfunction, they'll need a specific diaphragm breathing position to work through this. You can go through and assess the diaphragm, and I've got a sheet in the office that I give people that there are 9 different potential positions that people typically will test for, where if, say, it gets easier to breathe when their knees are bent and then their arms are overhead, and it fixes this diaphragm problem, strengthens the psoas muscle, that's the breathing position they need to do. And more often than not, when you start doing that, after about 5, 6, 7 breaths, you'll see everything in the trunk, like your lumbar erectors, your core muscles, you'll see everything just kind of melt into the table. And it's a really cool thing to see. I've experienced it myself, where I just feel everything just relax when you finally breathe in that right position, because everything that's fighting to hold on can finally let go, because the diaphragm kicks into gear and starts stabilizing. Well, this patient in particular, her posterior tibialis muscle just did not want to work unless she did the diaphragm breathing. And eventually it started working all right, but for some reason, right under her heel, she just still got all kinds of pain. And so there was one spot I would just take my thumb and I just kind of push in there, and she'd kind of jump. She'd just kind of jolt, be like, oh yeah, that doesn't feel very good. And I was like, all right, well, let's try doing your breathing position. Let's see how that does. And the one that I had given her the visit prior, she did that one, and it didn't change it at all. I was like, okay, well, let's work through these different positions and see which one is now beneficial for you, because clearly she's an outlier. She needed more than one position.
Yeah. And
we ended up getting to the next position that fixed the diaphragm. And I went and poked on her heel afterwards, and she said, I don't feel anything.
Wow.
So since we had worked through so much stuff, and it basically just boiled down to this diaphragm thing, I told her, if this is going to fix it, this is it. If it doesn't, then I'm happy to keep working through things. But quite honestly, I'm not sure what else to work through beyond this, because we've done just about everything. So what I had told her to do was, all right, that's your spot. Poke that spot on your heel. If it hurts, it means that you need to do your breathing position. if you poke it afterwards and it doesn't hurt, well, we know that you're still, benefiting from that breathing position. If at some point it still hurts and then the breathing position doesn't benefit it anymore, well, that just means that you've moved on to a different position, and we need to, basically just breathe for a couple breaths, a minute or two in each one of these positions, and then we'll see how that feels afterwards. And that's basically the last I heard of her. That ended up being a couple different visits in a row. We arrived on diaphragm things, and she needed to work through a couple different positions, and it just seems like her diaphragm was just totally thrown off, totally messed up. And every single time it just came back to finding the right position and working through that. So I hope she's doing great now. But what finally got it to where, a couple visits in a row, like I said, it's once you get to that point and it just keeps being the same thing, but just shifting through the positions, that just tells me that she just needs to keep breathing and keep working through those. So I hope she's doing great. It was just super interesting because why is it that there'd be some sort of pain there? Because you're stabilizing properly in your core. And I think it has something to do with that whole cascade of maybe one-sided pelvic instability leading to knee valgus, strain on the plantar fascia, you name it. It was very, very interesting. I know my story of it was probably all over the place and way too explanatory for what we actually ended up doing. But the reason that I thought this one is super important to mention is sometimes you have to work through a lot of stuff to get to where you actually find the root cause. But then also sometimes people are way more complex and messed up than others in a lot of ways when it comes to pain, because some people are way more active. They beat their bodies up more than others. Or some people just, they get, I guess their roll of the dice is just unlucky, and they just, for some reason, have more problems. And that's always the question that we ponder. It's, why is it that I did one thing with one person and it's like it changed their life, but then I've done 15 things with this other person, and for some reason it just isn't doing the same thing, yet they have the same, what seems to be the same complaint, the same things going on. It's just that's always the struggle,
Yeah.
But anyway, that's that case.
Man, that's really
very,
cool.
very interesting. So if you feel like you're very stiff, you've got a pain thing that just isn't resolving, a lot of times diaphragm could be involved.
Yeah, that's awesome. We had a episode a month or so ago on diaphragm, and it's not too difficult to find videos online as far as like, hey, here's how you diaphragm breathe. As far as we try to explain it on here, but sometimes seeing a video can be super helpful. But the diaphragm is so important. If there was an organ system, Dr. Tim, that we would say that like doctors don't talk about, it's not really taught on, I would say the diaphragm is probably that thing. And what's interesting, which we've talked about, is the diaphragm is a muscle, but the diaphragm also tends to at times function like an organ. What does that mean? It means that there are chemical things that can impact the function of this muscle, this diaphragm muscle. And to some people that sounds weird, but if I can just bring your attention to the fact that the heart is also a muscle and yet a massive organ. And so it's kind of an interesting idea to think of it that way. But the diaphragm can be huge. One of the things I've started incorporating, Dr. Tim, is sometimes I'll just kind of, when I get up in the morning and before I go to bed, I'll just kind of lay on my back, whatever position I've kind of found works best for me. A lot of times it's just kind of laying flat on my back and just doing like 20 nice and slow diaphragm breaths. It seems very balancing to my system. It's just like very therapeutic, kind of calms me down. And to your point with that case, I'm wondering too, if it wasn't necessarily just the increased core stability, increasing the knee stability, and then the ankle, stability and so forth, but if it was also that diaphragm breathing kind of increasing that overall vagus function and taking a lot of the stress off of the sympathetic nervous system and kind of reducing that fight or flight response, allowing their body to kind of calm down a little bit. And that could also be kind of another tie between the adrenals, able to like, hey, we can actually relax a little bit because we're not in this stressed mode. So interesting stuff. I love it.
I'm curious. Well, I never thought of it that way, but I mean, that makes a ton of sense, because of all the organs that you'll find primary emotional problems off of, love to hear your opinion, but adrenals are pretty high on that list.
Yeah.
Diaphragm, very high on that list. They are both significant victims of just emotional issues. More often than not, we end up finding chemical drivers of stress, but every now and then we get somebody who has emotional issues relative to organ complaints, and that's what's really driving it. So
yeah, for sure. So good.
legit.
So good. All right. So I'm going to go into this hormone case. So had a patient that started. Let me pull up some of my notes on this patient. So she's about 31. Basically, she had issues with her hormones and her period. So she'd have a period basically every 6 months. And when she would have her period, she would just get super irritable leading up to it. Life doesn't feel fair is kind of the mood she would have. She'd have cramps really bad, and just overall just feel terrible. And so she was able to get pregnant in the past. And one of the things that we talked about was she wanted to balance her hormones so she could have another kid. And so and working through this case is definitely interesting, because when you talk about a female that is very much in the age where she should be menstruating, she should be having a period, she should be having a cycle, her cycle was happening like every 6 months, which is so abnormal. It should be every 28 days or so. And so as we jumped into things, obviously there's different perspectives in the holistic world. You know, I'm not even talking about the mainstream kind of medical world where they are basically just going to prescribe some kind of birth control or something like that to try to help regulate things. But rather we're trying to get to the bottom and figure out, okay, what's actually causing this irregularity with the cycle. And as we got into things, yeah, we found a number of things like cortisol. We found some things like mold toxicity, which they did have in their home, and they got all that fixed up and stuff. So we found a couple of things there, but one of the things that we found that was really, really helpful was that there was actually an emotional thing that came up, and there was actually abuse in the past, a sexual abuse in the past, unfortunately. But it's like her body like held on to that, and there was an emotional piece of that too that her body held on to. And so we kind of processed through some of those things, and just kind of discuss that, and that can look like a number of things for our listener. You know, for some people, you know, I'll test, you know, oh, I think there's something emotional going on, and sometimes I'll test, hey, the way that everything's testing, it looks like this might have to do with an emotion related to the liver, could be related to anger, could be related to frustration. I might go through some of those things. And then I just let them be. I say, hey, you know, I would love for you to pursue this further. Like, hey, if you need to pursue counseling or therapy, I would strongly recommend it. If journaling is what helps you process through things, awesome. If prayer is what helps you, awesome. And then for that, we'll kind of jump into things that way. But we found that. And then also a lot of times we'll find, even when there is emotional things, we'll find that there's some deficiencies that can actually support the body in processing these emotions. And so I believe one of the big things we found was zinc, if I remember correctly. I'm trying to sort back through these notes, and this was a year or so ago. But zinc was a really big one. And then we had also found as well, one of the kind of clinical pearls that we've talked about, Dr. Tim, is ovary tissue in a supplement, taken at certain amounts and at certain specific times, can really help to get your kind of retrain your cycle and kind of get your system going again. Or if you have an issue where you're bleeding too much and it doesn't stop, you can actually use ovarian tissue to help stop the period and the bleeding and so forth. So that was one of the things she also tested for. And so we were very diligent with that. And so so we worked through all those things. And the last time I saw her, she was having a period. It was either I think it was every 28 days, maybe every like 5 weeks she was having a period. But I know the last time I had seen her, she was having one every month, which was which was awesome. And she was doing a lot of other things too. She started working out. I think she lost a ton of weight, like 20 pounds or something like that, if I remember correctly. But we got the period back, and I'll have to reach out to her and see how she's doing, see if she's had that second kid yet. But the hormones, all that to say, the hormones can be complicated and tricky. And, there's a book a lot of people talk about in our world, Dr. Tim, The Body Keeps a Score. And it's kind of a book that talks about how just different things in life, different emotional things your body can kind of almost hold on to some of those things. And then it can kind of manifest through your hormones, through pain, through gut issues and stuff like that. And one of the reasons why I really wanted to share this overall story is, we had a really cool outcome where this gal got her hormones balanced and her cycle regulated and all those good things. And her mood and all that energy, all that good stuff. But also to kind of point out the fact that sometimes things can be emotional and kind of rooted in emotions. And that's where, I really encourage people, and we talk about this in the office all the time. Holistic healthcare is not just looking at what supplements are you going to take. It's not just doing muscle testing. All those things are awesome, but holistic healthcare is really looking at, like, how is your mind? How are your thoughts? How's your emotions? And then, of course, how's your lifestyle? Are you moving? Are you eating well? There's a way that we ought to be living that is going to be conducive for optimal health. And really, those are the types of things that we try to get at when we're talking with patients and when we're talking on our podcast here as well. So the emotional piece. And to our listeners, I just recommend, like, hey, really take a second, if you haven't, and consider, how's my emotional health? Do I feel like my emotional health is free? What do I mean by that? Well, I mean, are there any emotions that pop up often or consistently that just really, like, cling to you in, like, a restrictive way, right? So could that be anger? Could it be unforgiveness? Like, are there any emotions? And a lot of times we'll see that if you hold on to these, that your body will hold on to these. And sometimes we can see that impact the health. So wanted to mention that more as kind of an exposure piece for people. And, it's something that I think a lot of times in the holistic world, we don't talk about as much, but it's always there and it's always important. So wanted to bring that one up. So Dr. Tim, any thoughts on that? Otherwise, let's kind of jump into your next case here.
Is that an allusion to the famous triad of health?
It is. Tell me about it, Dr. Tim.
So that on the topic of it not just being muscle testing, I would argue that applied kinesiology goes even beyond muscle testing, in that the philosophy and the holistic mindset behind it, like you said, encompasses the physical, emotional / spiritual / chemical aspects of health. Yeah. And a huge part of what we work through with patients is the chemical and the physical as we are treating people. And the system that we use, it just, which of those things carry the most weight? A lot of people would argue they're all evenly distributed. I argue they are not quite as much evenly distributed. I would argue the emotional stuff with most people, it is less, because we work through things and we just don't find that as much. I'm not sure. Could you hear that?
I totally heard that. That was really loud. Wow.
We've got some thunderstorms going on today.
Wow. You have an amazing mic.
Yeah, I'm gonna take some cover or something. It's funny. I remember back when I was in school, the anatomy professor, he had a pre-recorded video lecture, and during one of the lectures, there was this giant crack of thunder, and he goes, "Oh God! Oh, sorry guys. I'm sure you could hear that thunder. It scared me." And so it was just, he was on track talking about some sort of bone or muscle or something, and then all of a sudden was like, "Oh God!" It was the funniest thing. So anyway, I've been thinking of that since it's going.
Yeah.
But anyway, totally besides the point. But anyway, triad of health. Sometimes with patients, when it comes to emotional stuff, we'll just have a good cry right there in the office, and that will actually clear the indicator with the testing.
Dude, that's awesome.
I'm just kidding.
Oh, really? Okay.
No, we won't. I won't cry with my patients. It makes me uncomfortable.
Dude, we got a big box of tissues over here, literally on our table, and it's like, I mean, I'll be talking to people. I'll be talking to patients, just talking through things, and if there's something there, I'll kind of say, like, hey, is there something there? Is there something kind of emotional there? And I'll ask in the sense of just trying to be comprehensive. But of course, if it's like a sore spot of like, I'm like, totally, I'm not, going to press into that.
Yeah.
But a lot of times, I mean, patients feel super comfortable here and they'll just kind of share things and then bam, they just release. And it's like, hey, a lot of times they're like, I'm so sorry. I'm like, look, I'm here for it. Like we got a big old box. You see that box right there? That box is for you, sister or brother. That thing is for you. So it's great.
I feel like those get used for tears more than they do actually drainage or
like blowing your nose,
boogers or anything,
yeah.
Or the tear tissues.
Yeah, totally.
So yeah, I won't cry with the patients. They'll cry quite a bit, but
yeah,
I don't quite join in.
Yeah, I've probably had one or two times where somebody had said something. One was I just a quick side note. I shared about the patient in the last episode. I think I briefly shared this little girl, I believe 11 years old, diagnosed with eosinophilic esophagitis. So a condition that you mentioned, Dr. Tim, was kind of part of your journey into the holistic health world. And basically, there was two moments that were really kind of touched my heart. One was when I asked, I'm like, hey, what are our goals at our first visit? And it was like, hey, improve sleep, improve this. And I said, how about get rid of the eosinophilic esophagitis? And she was like, you can get rid of it? I mean, watching this little 11-year-old girl, she's like, you can get rid of it? I was like, yeah. She's like, all the other doctors told me I was going to have it for forever. I was like, oh my goodness. And then on our follow-up visits, I think it was literally like the next visit, I think she had, we had found like parasites and food sensitivity and something else. And by our second visit, she originally had to close her mouth at all times, so she would prevent from spitting up. And by our second visit, she, that was happening maybe once a day, like every once in a while, not 24/7. And so she was so thankful. She wrote me the sweetest little letter ever. And as she was just telling me about this, she was like, thank you so much. She's like, no, she literally said, you've helped me so much in just one visit. She's like, and no other doctor has ever helped me like that. And literally, I'm just like, bro, I'm about to cry in front of this girl. So it was a sweet moment. But Dr. Tim, I digress. You had another case, and I want to make sure we get to that today. So,
yeah,
what do we have next for us?
So the next one on the list, this is what I would argue one of the most profound cases that I've seen. Just in that it was such an obscure complaint that you know how it goes. I mean, you have a phone consultation with a patient. You go, okay, well, so let's chat about what you got going on, what prompted you to call, all this stuff, and so we'll chat about how I can help you, or at least help you on your path. And this girl's mom calls, and she's like, hey,
how old's the girl?
She was 15. I'm sure she's 16 now.
Gotcha.
But she actually is the daughter of a really good friend of your receptionist. So just so everybody knows, the whole reason that this girl ended up coming to see me was Dr. Joel saying, hey, go see Dr. Tim instead of me, because they live pretty close to me. And it would have been like, what, a 6-7 hour drive to come see you.
Right.
And your receptionist told her, hey, why don't you come see Dr. Joel? And you said, oh, it'd be way more convenient for you to go see Tim. So go see Tim. And so very thankful, because not only did I help her out a lot, and daughter came to see me, mom came to see me, that she also, I mean, so many people from the area came to see me because she was just so thankful and referred so many people to me. So it ended up being a huge blessing.
Love it.
They really, all the people that I had met from their little community, incredible people. So anyway, but beyond that, the actual case and what people are waiting for. So this 15-year-old girl, and hopefully I'm remembering correctly, she always needed a pinch runner for softball. She would play, I believe she played volleyball. So she was standing around a whole lot, didn't actually end up doing a ton of running, because any sort of running would just cause excruciating pain in her femur. Her thigh would just kill her. And she had, over the last couple years prior, gone through a ton of testing to try to figure out what's going on. She had MRI, CT, I believe, all the things. And what they had found was a benign bone tumor, that the next step in her whole plan of care was narcotics or some sort of heavy painkillers at a pain management clinic to help it not hurt so much. because she was always in pain. It was always painful. It hurt to sit, it hurt to stand, and then running just made it just absolutely awful. And so with that being the case, they, as you can imagine, with a 15-year-old, lifelong narcotics, that's probably not a good idea. I would say
Not ideal.
very not ideal. Yeah, we'll put it that way. It's just not optimal for sure. So they had decided, okay, well, based off of not really having any better options, they listened. They came up here, and right off the bat, we were testing some things, and I had told her on the phone call, yeah, I'm not sure we're going to come up with. This is kind of an obscure complaint that I haven't dealt with before, but based off of what your friend had told you about the work Dr. Joel does and what we do, we'll at least find you some answers. We're going to find something. We'll just have to see how it goes. And it was probably the most wishy-washy, not guarantee type of phone consultation that I have ever had with anybody.
Would you say that's abnormal?
Oh yeah.
Yeah.
Most phone consultations is like, oh, I've got fatigue, I've got hormone issues, I've got this going on, and it's like, I see this a lot with that. And sure enough, they'll come in and bam, they've got it going on. It was just like we talked about, like with the girl with the left-sided neuro symptoms with the gallbladder and insulin thing. I'll have these ladies that call and they're like, I've got all these crazy weird problems. And it just boils down to, oh, I just have a hormone issue with my gallbladder. And it's like, that is such a basic issue for such weird complaints. But this was totally different. This was like a bone tumor that was actually visible on imaging, that there was no infection present, things like that. But once we got testing, that's where using, the systems healthcare technique, I ended up finding an infection. And so they had aspirated it, found there was no infection. And then I found infection. So with that being the case, here's kind of my theory. Because, well, actually, let me just talk about how it went, and then I'll talk about my theory.
Yeah.
I gave her an herb day 1. 2 weeks later, she came back and said it was probably 50% better.
Whoa. And she had seen like how many doctors, like hadn't seen any improvement or what?
It'd been going on for like 4 years.
Whoa.
And she was 15. So this is like, basically a third of her life she'd been dealing with this pain and not able to just live a normal kid life.
Man.
She came back 2 weeks later, 50% better. Came back 2 weeks later after. So I gave her another herb the next day. And then 2 weeks later, she came back and it was basically where it was the visit before. So I was like, okay, didn't do quite as much. But I couldn't find anything. And I was like, what the heck's going on here? I ended up combining all kinds of stuff together, infections with acetaldehyde and just all kinds of stuff, and ended up pulling out an acetaldehyde problem. Gave her some molybdenum to help detoxify the byproducts of the immune system dealing with whatever infection may have been present. Came back the next time, no pain, 100% better.
Whoa.
Completely better. That was just like, really? Oh, all right.
You're like, yeah.
Yeah, great. Awesome. Cool. Well, that went better than I thought it was going to, quicker and better. And so it just ended up being great. The mom did message me months later and was like, hey, she's getting a similar pain, but it's in her hand this time. And so I don't know what was going on with that. She didn't end up coming in for it, but I'm curious as to if there's some sort of weird thing going on with her immune system that's contributing to her developing these little tumors or something like that. I don't know. Definitely interesting. So anyway, that was something later on, but at least for the primary complaint that she came in for with the tumor that she had zero relief for years and years and years, it ended up being a whole lot better and completely better in just 3 visits. It was incredible. But here's kind of my working theory. So she, back in school, I mean, we had, I don't even want to know how many hours of diagnostic imaging stuff that we had, but we had 4 different diagnostic imaging classes actually 5. And the 4th class, diagnostic imaging 4, was probably the biggest class that, whoa, excuse me. Sorry, that came up out of nowhere. Diagnostic imaging 4 was probably the most intense course in the whole program. I would say, I don't know if you would have similar opinions, but that weeded out, I think, more students than any other class in our program. And so we had some very, very intense radiology classes, and the professors were very unforgiving with stuff, which I respect. Our profession needs to be taken seriously, and we need to know what we're doing. And one thing that we had talked about in our diagnostic imaging classes a ton of times is something called a Brody's abscess. And a Brody's abscess is basically some sort of infection that enters the bloodstream and gets deposited in the bone somewhere. Usually it's highly vascularized areas of bone where it's the ends of bones, things like that, or towards the marrow. And then from there, the body will do what they call sequestering of this infection, where the body will basically calcify an egg type shell around it and totally cut off all blood supply and all oxygen to where the infection will basically die. And then from there, night pain and just pain throughout, like constant pain throughout the day that gets way worse at night is a textbook presentation for a Brody's abscess. And that is exactly what this patient had described. Well, when you actually aspirate it, there isn't any infection. And so that's the kind of the theory about how it gets there. But here's my idea. Why is it that I found infection, but there wasn't actually an infection? My idea is that there once was, and the immune system is still mounting a significant Th1 immune system response to try to fight off and balance what's going on there, but it couldn't fully finish ramping up that response and balancing itself back out afterwards.
Right.
So the 2 herbs that we did to deal with whatever, quote, infection was there, finished that job, and then we were able to work through whatever was left over afterwards that the body may have been bottlenecked on previously. And that's what finally dealt with it.
It's interesting.
So maybe just kind of an idea, but that's the only thing that would really make sense. Based off of the imaging report that I had read, they didn't necessarily call it a Brody's abscess, but it sounded like it was a Brody's abscess, and the way that it was a sequestered tumor that seemed to basically be totally walled off and no other cause with all the signs and symptoms that went along with it. It's, in my opinion, the only thing that really made sense. And so I don't know. All I know is that is what fixed it. And that's what the imaging report said. So all I can have is ideas on it, but all I know is that it was probably one of the most profound things that I've ever seen.
Yeah.
And it went really well. And I'm very thankful that it did, because what kid wants to not be able to play sports and live a normal life because she's got this tumor in her leg? You know, is terrible. So all in all, turned out great. Turned out really, really, really great. So very, 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 very thankful for that.
That's so thankful. So thankful. That's awesome. Yeah. You know, and another thing too, that you kind of bring to light with that, and I know we need to wrap up here, is the fact that the immune system does not just kill infections, but probably one of the things that you're helping with there as well is with strengthening the immune system. The immune system is also not only going to take out infections, but it's going to help with inflammation. It's going to help with detoxing. It's going to help with repairing and things like that. So there's so many different aspects of the immune system that doesn't get much attention or exposure. And I'm sure that there was definitely a piece with that as well. All right, I'm going to share. Can I run through this last case here, and then we will wrap up? So patient came in. Patient was about 17 years old, played high school sports. And I'm going to pull up some of these notes here because this was like 2 years ago. And basically this was a Wednesday. On Monday evening, he twisted his right ankle in a game, thinks he landed on somebody. His ankle popped, which when you have ligament injuries and injuries in general, and there's a pop, that's never a good thing. And so the pain was like 8 out of 10 in that right ankle right after. By the time I saw him, like he kept it taped and wrapped, and then he'd been icing it and elevating it for like basically like the entire time until I saw him 36 hours later. And so saw him, the pain was still like 5 out of 10. He could walk, but it still hurt a little bit. Definitely couldn't do anything more than walking, like jogging or running or jumping. And then the ankle would generally, pop a little bit, and just was kind of stiff and angry and so forth. So we jumped into things. One of the big things we find, Dr. Tim, we've maybe talked about this before, but for athletes and ligament injuries, one of the number one nutrients that athletes and people need when they have some kind of ligament injury, like an ankle sprain, any kind of joint sprain, is manganese. So not magnesium, but manganese. And manganese is super, super high in overall ligament tissues. And so what he was testing for, which we find to be pretty classic, is instead of taking like 1 to 2 tablets of manganese at a time, you need 9 tablets of manganese 3 times a day. And this bottle of 100 tablets, you basically go through in like 3 days because you're taking like 27 a day. So that was one of the first things that he tested for, understandably enough. I've seen this many times before. Ligament injuries, you need manganese. If you don't have manganese, the ligaments are not necessarily going to heal very quickly. And if the ligaments don't heal quickly, then there's going to be a lot of tension and tightness because your muscles don't feel like the joint is safe. And so that's been a huge thing. We also found mold on his system, ironically enough. The schools in Kansas, just a little side note, a lot of times what I found was at least the area that I was, a lot of the schools were on the older side and tended to have a lot of different mold issues. So he needed molybdenum to help detox the molds. And then we worked a lot on the muscles in the ankle. Some of those muscles you talked about, the anterior tibialis, posterior tibialis, the fibularis muscles. We worked on all of those guys and on the ligaments. And so had him stand up, and his mom says, why do you have a stupid look on your face? And I was like, what? And she goes, no, like stupid, like you look stupefied. And he goes, because my right ankle, which was injured, now feels like my left ankle. And I was like, whoa, that's pretty cool. And so it was feeling better. So I said, okay, I want you to like go up on your toes, walk around. How's that feel? He's like, feels really good. I was like, all right, I want you to start jumping up and down. He's like, okay. So he does it. And he's like, yeah, there's still some pain right there. So had him do that to kind of aggravate whatever was still going on, worked on some things, found some deeper things that were kind of going on related with some gut infections and then a zinc deficiency. And the zinc was, I think, related to an ammonia toxicity, but it was deficient in impacting his overall anaerobic function. So his ability to do more high intensity activities and things like that. So had him take some zinc right there, had him take this herb for some gut infections, and then had him jump up and down. He's like, feels great. I was like, awesome. So I said, let's go out here to the foyer of the office. I said, I want you to jog across the office. So he jogs, he comes back. He's like, feels pretty good. I was like, awesome. And I said, I want you to like jog faster. And so he jogs even faster, comes back. He's like, feels good, but there's a little bit here. So worked on a spot or two. I think he may have needed magnesium, if I remember correctly.
You needed all the M's, MO, MN, MG.
Yeah, that's right. All the M minerals for sure.
Are there any others? I'm going to pull up the periodic table.
Oh my word. Nerding out over here. So had him take a magnesium. And then I said, all right, I want you to try to kind of do that quick jog again. He did it, came back. He's like, feels great. I said, awesome. I want you to run as hard as you can for being in this office and having like 15 yards of space or whatever it was. And so he did. He ran across. And this dude, he's 17, but he's a pretty big guy. And, overall strong dude, and played football and basketball and all these things. And so it was just funny, though, him running across the office. Now, thankfully, it was kind of after hours. Nobody was there. So it maybe would have been a little bit more entertaining if people were there, right? But he comes back and he's like, feels great. I was like, heck yeah, let's go. And so in this case where, he would have been icing and been out for like 2 weeks, 3 weeks, and then maybe tried to come back sooner than he probably should have, but with an ankle brace and maybe some ibuprofen or something like that, and still not have a super stable ankle. Instead, we were able to jump into things and work to get to the bottom of things. And I think he got back into kind of training and moving a little bit more after that day. And then I think he played in a game like 4 days later or something like that, and didn't have any issues. Didn't have any issues after that. Didn't wear an ankle brace. Didn't need it. I think he might have wrapped it, but he was doing good.
I could have used you in high school, buddy.
I could have used me in high school, buddy. I could have used me in high school.
I've still got some ankle issues after rolling my ankles real bad in high school.
Bro, come on. Get over here. We'll get it figured out, Dr. Tim. We'll get it figured out.
I need some help. You got to fix my ankle. Maybe I need some manganese.
You honestly, if you haven't done a high dose, you probably do. I jammed my finger a long time ago in high school when I was testing myself. So recently I was going high doses on manganese and it's been feeling a lot better, So yeah, I know, wild stuff, but we can check it. We can check it. I think back to like all the things I've been able to help patients with, like getting over injuries super fast and healing super fast, gut issues, all these things. I'm like, man, I wish I had me when I was in high school. I think sports would have looked a lot better for me.
Yeah. I'm like, man, what if I had the knowledge that I have now? I would have been jacked. I'd been all state. I always think of like, have you ever seen Napoleon Dynamite?
Yeah.
I'd be like Uncle Rico. I'd be like, yeah, I used to be able to throw a pigskin a quarter mile.
Oh my goodness.
What could have been, man? What could have been?
I believe it. All right, Dr. Tim, we're far over our time and we need to get rolling here. So let's go ahead and wrap up.
All right.
I'm Dr. Joel Miller. The practice here is Freedom, Health, and Wellness. You can find me online at drjoelmiller.com. You can find me on Instagram at, I think it's just dr.Joel Miller. You can find me on YouTube. If you guys have any questions, need any guidance or any help, feel free to visit the website, find the office number, shoot us a text or give us a call. And we'll be happy to help you in whatever way that we can. Located in the Dallas, Texas area. And again, be happy to help. So Dr. Tim, tell them a little bit about how they can find you and where you're located.
I am Dr. Tim Augustiniak down here in Bentonville, Arkansas. You can find me online at flourishfwc.com or draugustiniak.com. That's draugustiniak.com. If you have any questions, comments, concerns, or suggestions for future episodes, feel free to reach out and let us know. On the homepage of my website, there are links to all the socials, as well as links to the podcast and links to, or at least all the contact info, all that stuff. So yeah, let us know if you guys need anything. If not, we will see you in the next one. And thank you so much for tuning in.
Cool. See y'all.